Hello there, how are you?
For almost 6 months, he's talked of almost nothing else, but protecting the NHS from coronavirus has caused a backlog in cancer care.
This is routine breast screening.
2.5 million people are estimated to have missed out on screening, treatments and operations. But the Health Secretary announcing £50 million for advanced cancer equipment at this hospital in Cambridge told us the NHS can cope with more than just COVID.
It was very important when there were a lot of new cases of COVID that people weren't made more at risk of COVID because of treatments, especially for cancer. But now it's incredibly important for people to come forward.
On the backlog, when do you think the backlog will be sorted?
Since the peak, we've already brought it down by half. So that is making significant progress.
So when are you thinking it will be over, when you can clear that backlog completely?
Well, I very much hope that will happen in a matter of months.
For this year?
Well, the reason that I'm not putting a precise date on it is because it depends on how much COVID there is.
Can you guarantee, heading into the winter, that people who need cancer treatment or need a cancer operation won't have it cancelled again?
I don't use the word guarantee. What I can say, though, is that we are already on the path to recovering the situation.
But this whole situation can only be resolved with COVID under control, and that may only come with a vaccine.
Well, we don't rule out a vaccine coming on stream this year, but we also, by no means, is that a done deal, and next year is more likely. Each sign at the moment is going well and going in the right direction, but I don't want to raise people's hopes too much.
His hopes, like the country's, are in the hands of scientists, but does he worry the country's trust in the government is slipping?
The A-level results algorithm, free school meals over summer holidays, the NHS surcharge for migrant workers, all primary school children back before the summer holidays, face covering in schools. What is it about this government that has led to so many U-turns?
We're dealing with a crisis that is entirely unprecedented. We're dealing with a disease that didn't even exist, as far as we know, before December last year. And so we're taking decisions guided by the science.
What changed on free school meals? What changed on the bereavement scheme?
What people would get really cross about is if a government refused to change a decision, even if evidence came up that there was a better option.
But is it evidence that it's the wrong option, or is it evidence that it's unpopular? Isn't this proof that either the government has poor instincts or that it has a lack of conviction?
No, it's a proof that the government is constantly listening to updating evidence and making decisions accordingly.
And as the NHS prepares for a crucial winter period, many lives will again depend on those decisions. Daniel Hewitt, ITV News.